diet culture mentality of eat less, be smaller, work harder, right? So let's
Mhm.
kind of dissect that a little bit. Let's talk more about like why is that the case and what do you do to help women sort of transform their mindset around that?
Yeah, and that's great, and that's exactly what we see too. Is a lot of women sort of double down on what's worked before, and especially in perimenopause, which is that 10, 15 year period before your fertile years end and you transition into a non-cycling female, no longer having periods. So yes, a lot of women start restricting quite a bit more, and maybe some restriction worked for them in the past. And cardio, we were always taught that doing more cardio, burning more calories, being hyper fixated on calories and having as little as possible is the way to go. So I think it's a huge jump, and just helping women feel safe in their bodies to nourish the body, to start eating for energy. And I loved your definition of metabolic health. You know, the way I think about it is what happens to food after it goes in your body? Does it turn into fuel and help fuel your passions, your energy, your body? Or does it get stored as fat and become a source of inflammation and a risk factor for poor health? And you know, the timing of your meals, what you're eating, how you're eating, the timing of your movements can all impact your metabolic health. And when I start working with women, I usually look at fasting insulin just to get an understanding of if there is some insulin resistance, as well as a couple other labs like a hemoglobin A1C, which tells you your blood sugar average over 3 months, and a fasting blood sugar that gives us some idea of that goes far beyond the number of the scale. How are you fueling? How are you fueling? And are we turning that food into energy? And you mentioned blood sugar and why it's so important. And again, yeah, a lot of people think this is only a problem if you're diabetic, but blood sugar, if it cannot get into cells, if it stays in your bloodstream, it is toxic. It becomes very toxic. It is what breaks down our blood vessels. The number one cause of death overall in the US right now is cardiovascular disease. And that destruction of our blood vessels by blood sugar just sitting around causes that, as well as our brain vessels. And it causes a lot of inflammation, which can cause fat gain, mood swings, low energy, bad sleep. So it's all connected, you know, and we touched a little bit about how medicine is so siloed. And that's exactly what even going through my medical training, it never just made sense to me. How can people be staying in this very narrow lane